Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. So what are the effects of fatty liver disease on your health and your life in general? Joining me now to give us answers is ExpressCare's Dr. Jitka Lom. Welcome.
Hi, Jolie.
Hi. Okay, so can you share with us, what is fatty liver?
Right, and why should we even care? Great question. You know, fatty liver affects something like 30% of the world's population, and it's just getting worse and worse, but it's something that many people have not really heard about. Usually what will happen is you'll have your annual health exam, maybe do some blood tests, and then show up at your doctor's office to go over them, and your doctor say, oh, your liver's a little bit irritated, probably you have fatty liver. And then you're, well, okay, so what? Well, so here's the process, okay, Jolene? So when we eat, our body digests the food. Whatever we don't use, we store. So let's say if you break down the food into, let's say, glucose, that gets used in your bloodstream if there's an opportunity. If there isn't, it gets stored as glycogen, which is a type of starch in your liver. And then when the liver's full of starch, then there's basically fat that starts getting stored there. And as you store more and more fat, these are actually triglycerides, those are the small fats. As they get stored there, the liver gets more and more full of that, and the liver itself, the cells of the liver cannot function. So it's basically overloading the liver with fat. And then the liver starts to get inflamed, it can't detoxify the body. And the end path of it is actually cirrhosis, exactly the same thing that happens when people drink too much alcohol. Except for in this situation, they haven't been drinking, they've been just eating too much of the wrong kinds of foods, packing their liver with fat, and eventually over time destroying it. So actually fatty liver, or there's a medical term, non-alcoholic fatty liver disease, that one is rising as a cause of liver failure in the world.
Okay.
So that's why we should care.
Okay. Now, can you share with me, because I've never heard about fatty liver.
Right.
What are some of the symptoms that, someone can look out for?
Right. Actually, probably none. Most of the time this is completely silent. It's, it goes kind of along with the diabetes, high blood pressure, obesity. This is sort of what we call metabolic syndrome. Basically people that are obese, okay? And then they look down and they've got a big tummy and you tell them they've got a fatty liver and they're like, yeah, there's fat everywhere actually. But they're not realizing that the damage is being done to their liver over time. Now, not everybody with fatty liver will go on to get severe liver disease like cirrhosis, need a transplant, but some do. So when people are aware of that their liver is not functioning as well as usual, at least they can take some steps to not make it worse, such as drinking tons of alcohol, okay, because that'll poison the liver even more.
Okay. Now, you mentioned to me earlier that a lot of those who are diagnosed with fatty liver are in their 40s.
Right.
So how long before they're actually diagnosed, does a person typically live with this before even realizing they have it?
That is such a good question too. So the way this works is that the liver is actually an incredibly resilient organ. It's one of the organs in our body that is able to regenerate, kind of like our skin. You can really destroy a large portion of your liver and have it sort of repair itself and recover. So over time, people basically are overloaded, let's say through their excessive sweets in their diet, too much sugar, too much fat, too much food in general, too many calories. So they're overloading their liver gradually over time. This is more like a 15 to 20 year process. The amazing thing though is that we're starting to see young people with this because of childhood obesity. We're seeing kids, even I have several patients in their teens and young adults who actually already have fatty liver. So it's something that's becoming a bigger and bigger public health concern in the world and here on Guam for sure.
Okay. So what types of tests can show that you have fatty liver?
Yes, excellent question. So, the typical test that you'll have is a simple blood test where we check the liver enzymes. Liver enzymes are produced by the liver. The more of them you produce, the more stressed your liver is. So we look at normal or low numbers being good. The higher the numbers, the more irritated the liver is. So that's the first step. The next step is if you see that, we do some follow-up blood tests and we do an ultrasound. On an ultrasound, you have about an 80% chance of detecting a fatty liver. If the person isn't too chubby on the outside, you can see the liver quite well and the liver will look fatty. And the gold standard is to do a liver biopsy, where they numb your skin first and then take a very long, thin needle, put it into the liver, and then send it out on a microscope slide so that the pathologist can look at it under the microscope and see, yep, there's a lot of fat in the liver, and then to tell us how much inflammation there is in the liver and how much destruction of the liver that they're seeing.
Okay. Is there a diet or proper foods that I should be eating to ensure that I have a healthy liver?
Yes. The first thing is to avoid liver toxins. Those would be medication that go through the liver. You can ask your doctor about those. There are some. In particular, we could talk about Motrin, those kind of medications that might go through the liver, anti-inflammatories, certain antibiotics. There are several or many medications that are harmful to the liver. Then we have the problem of alcohol again on this island. And finally then, what are healthy foods to eat? That's our high fiber, we talked about that last week, high fiber diet with a low sugar, and minimizing the deep fried or really greasy foods. You need some fat in your diet, but trying to balance it out with lots of healthy fruits and vegetables.
Okay, so besides alcohol, of course that's not a food, but what foods should we stay away from to prevent it?
The very sugary foods, highly processed foods, there's a lot of research into fructose. Now you all have heard about high fructose corn syrup, okay? Maybe you see that as a sweetener in a lot of drinks and especially juices and so on. Now that's become sort of not that popular, so they've substituted other sugars in there. But high fructose corn syrup or other very sweet things are not that good for us, because when we eat them we get a really high sugar load all at once. Remember I said your body will use whatever sugar it can right at that time to burn it. You know, your muscles will use it. But if there isn't anything happening, meaning you're not having a strong workout right at that time, the body's got to do something with all that sugar, and it'll end up storing it in your liver in the form of fat. So staying away from sweet things is a really good idea.
Thank you, Doc.
You're welcome.
Stay tuned. We answer your questions.